So it's kind of gone full circle. Last year I was a patient not being able to walk, and now I'm sat here about to interview you about your new ebook. So for all the audience, this is Abid Hussain from abidhussain.co.uk and Dr Foot himself. We're about to talk about his new ebook, The 3-Step Solution to Toe Scar Trauma. But before we get into that, can you give the audience a brief about yourself, how you got into this, what is it exactly that you do, and how are you known as Dr Foot?
Well, I have been a podiatrist for a long time, 25 years. As I tell all my patients, don't be fooled by these amazing good looks. I'm really old. I discovered podiatry in 1992. Just by luck, I was observing some podiatrists, and I thought I really like the look of helping people to feel better about the appearance of their feet and to make them walk without discomfort and pain. I then went to the University of Westminster and I qualified in 1995. For the last 25 years I've been a podiatrist. I've worked in the NHS, I've worked in private practices all over the world, in Dubai, in London, in Birmingham, which is my home city, which I think is the best city in the world. And I launched Dr Foot. Now the brand Dr Foot has been going since 1997, 1998. I created the first online website to sell foot care products in the UK. This was before the time of Google and YouTube. So as a podiatrist, I taught myself how to design websites and do graphics, which was a challenge. And ever since then, I've been helping people with their feet, and it's something that I have so much passion towards. I love the idea of being able to help people walk without discomfort, do the activity without discomfort, and to feel more comfortable about the appearance of their feet.
Yeah. So I mean, that's certainly how I got in touch with you, not being able to walk. So podiatry is clearly your passion. You've turned it into your livelihood, and you're already focusing on getting better. I know you're taking a doctorate and you're harnessing your craft to get better and better. So whilst doing all of these things, how have you had the time to pioneer this new treatment? I know before it was quite invasive. There was a bit of a backwards way of dealing with this, and in the midst of being able to do everything that you do, you've pioneered a new treatment, a new brand, and an ebook. So how have you managed to do this, and where did this all come from?
Well, it's from a pure frustration that I've had for 20 years now, over 20 years. So I've worked all over the world. I have had a lot of women of color that have come to my clinics, that being Afro-Caribbean or South Asian women, that have complained about toe scars. And what we're normally told as podiatrists is give them foot care advice, give them footwear advice, and provide them surgical options. And I thought to myself, there has to be a better way.
It sounds very painful. Surgery immediately. So what have you come up with then? Now, you've seen a gap in the market, but when did you realize something like the toe lift was needed?
So back to my frustrations regarding these scars, which are caused because of tight footwear, and sometimes foot structure as well. A lot of female patients obviously don't want to have surgery because it's a very invasive treatment option. You're having screws put in, you cut in bone. Once you do that, there's no going back. Once you've cut bone, that's it. Then you can't put the bone back in place. Once you put a screw in, after 10 to 15 years, there's going to be obvious effects of that screw being in your toe. So you might have a straight toe with no scars on your foot, but then you might get secondary pain. So it was a few years back. I was in clinic and I had a Afro-Caribbean patient, female patient, come to the clinic complaining of scars on the tops of her toes. So I did what I normally do. I gave her foot care advice, footwear advice, I provided the surgical options, and then she burst out into tears. And I asked her why she was so upset, and then she told me she's not going on holiday to any warm destinations, she's hiding her feet away, she's not sleeping properly, she's having a great amount of anxiety, she feels as everybody's looking at her feet, she doesn't wear sandals. Even if it's really warm. And I thought to myself, I need to take this seriously. So then I went on a quest. I went on a quest to find a non-surgical solution for these scars that are on the tops of the toes. I spoke to my fellow podiatrists, and I wasn't getting much luck. So people were telling me there is no solution, you can only have surgery. And I thought there must be a solution. So I spoke to dermatologists, and I spoke to dermatologists all over the world. I spoke to a few dermatologists in America, in New York, which really changed the way I thought of the treatment regarding toe scars. And that's what really got me started into finding a solution for these toe scars, and I came up with a procedure which I have then called the toe lift.
So that, I mean, that's amazing. Just to pick up on what you've just said, the idea that the treatment that you were giving actually probably resulted in toe scars getting worse primarily, and two, the idea that toe scars affect more than just the physical, the feet. It's the idea that these women were actually silently suffering and not saying anything. I mean, it must have been, especially with this lady that came into your treatment, it must have been very hard to see this lack of self-confidence based on something like scarring. She must have, must have been a wide awakening.
It was. I mean, it was a huge awakening for myself, and I think a lot of my colleagues don't take this seriously,
Right.
because they don't understand the psychosocial impact of scars. And obviously, because they're on your feet, you can hide your feet away. So when females and males have scarring on their faces or other parts of their body that are visible, we take that a lot more seriously, and we take the psychosocial impact of that and the contributing anxiety that you can get and the depression that you can get a lot more seriously.
Yeah.
But what many of my fellow podiatrists don't understand is having scarring on the feet can have just as much of a psychosocial impact and can really affect your quality of life. And that was one of my huge motivating factors to really go on the quest to find a solution.
Yeah, a non-invasive, non-surgical procedure. No, and that's absolutely amazing. So you've told us a bit about how the toe lift has come to fruition. This wonderful lady that had helped you pioneer it, and your mission, going around, you talked to dermatologists and went around the world looking for a solution. So without giving too much away, how exactly does the toe lift work?
No, it works with giving a series of injections. So they are not painful at all. When I normally talk about injections to patients, they think pain. They are as pain-free as I could possibly make them. So you come in 1 week, you have injections into your toes, and that will cause the lesion to shrink drastically. The following week you will come back in again, and I will give you a different type of injection that's often used for acne scars.
Okay.
That really fades away the scar quite a bit. Following this, I give you a tailored 12-week post-treatment aftercare plan. This is tailored for the individual person, and this can then give you the kind of results that you really want to see.
That's absolutely amazing. So not only do you offer sort of the toe lift procedure, you have an aftercare procedure in place. Obviously it has to be unique depending on the person that comes. Everybody's different, and I know that you're doing a consultation prior to it as well, so you can personally assess the feet and give them real advice. And that's definitely one thing working with you. I think it's really humbling and nice when you go to a profession and there's truth to it. You're so honest with your clients, and I think that's very important, to be transparent about something so important, something that seems to be such an important and needed surgery. So it sounds amazing. Have you actually carried any out? Have you done any?
I've done quite a lot, over 100 now.
Wow.
I've had females from all over the world coming to see myself to have the toe lift done, which is an incredibly humbling experience. And I'm very honest with my patients, because I know the impact that scars are having on these females. I know it's taken a lot of courage for them to come to see me, for them to show me their foot, because you want to hide it away, and you're incredibly embarrassed of it.
Mm.
So I am incredibly honest regarding the results that the patient is going to get. Some patients get complete a regression of the scars. Sometimes they fade substantially, but it varies from patient to patient.
Mm.
And I try my best to be as honest as possible and to tell the patient that this is the kind of outcome that you are going to get.
That's absolutely amazing. So again, with something like this, I think it is very important for them to be able to sit down with a professional like yourself and get coached through it, because it must be scary to get in there and have the toe lift done. So I'm guessing this is why you've released your ebook then.
Yeah.
So I know you were talking to me about reach, and especially this lady, how she opened your eyes to the impact of toe scarring. And I know you're very busy. Busy is good, but you're not reaching as many people as you'd like to help. So I know you've just made your ebook. It's amazing. I've read through it. Can you tell me why not only have you made it free, but I know that you've got a couple of gems in there that you are teaching some of these people, teaching the ladies that will be downloading them. Without sharing too much, could you give them an insight into what they're going to learn in the ebook?
So I spent a long time writing the ebook itself, and it was a result of a lot of effort and a lot of research. What the ebook does have within it is some awesome home remedies, which you can do if you want to start on the process of trying to help your scars that are on the tops of your toes. And we've got some surprises within the ebook as well. Once you download it, you will find so much information, and you'll get to know more about my journey, why I chose to help as many women as I could with these scars.
Yeah, and I know as well, for everybody that downloads the ebook, especially through this link below the video, you're also giving away a free training series with it, where you're actually on video guiding them on what to do.
That's right.
And I know you mentioned the home remedies. So that's not acid or anything. Is that natural? So anybody at home watching these videos and downloading the ebook can do this?
So the problem with the toe scars is people think that they are corns, or even worse, verrucas. They pop into a pharmacy, a doctor's. Sometimes fellow health professionals might say, go and use an acid, any type of caustic, and it makes the scars much, much worse. So the home remedies that I do not have any acids, because they are not corns and they are not verrucas. They are hypertrophic type scars caused due to poor fitting footwear. So a lot of the remedies that I have recommended in the ebook, which you should download, are safe to use, and they won't make your toe scars any worse.
So that's amazing. So I know, again, the ebook is completely free, and you've done that for sure. I know it's not going to be free all the time,
That's right.
but you've done that to get the reach out there. I know inside you talk about the remedies and so forth, but I know that for a limited time only, is that you're giving a free callback and a consultancy, is that right as
Yes.
well? So you really are, you've got this holistic package that you're offering at the moment, isn't it?
I want the patients to feel as comfortable as possible. So I am offering the patients to get a free callback by myself, not from my secretary or not from anybody else that is working as part of Dr. Foot, but myself. I will find the time to call you and answer any questions that you have. And we have a discount on at the moment for a 50% off for the initial consultation, while the offer lasts. Now, this is not going to last forever. This is for a short term only.
Period of time. No, that's absolutely brilliant. And again, coming from somebody like myself who did use acid on my feet to treat it until I met Abid, and who educated me, to now see this go full circle and to now see you helping all these women, I'm very proud of you. I think it's amazing how far this has come. And I really, truly hope that you can reach the amount of women that you want to reach with this. Please, 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 if you're interested, make sure that you download the ebook. There should be a link at the bottom of this video. Have a read through it. It's absolutely brilliant. There are some golden gems in it, and inside the ebook will be a link that will allow you to get the 50% off consultancy. He's going to call you back, talk to you about it. His surgery is amazing. I can vouch for this, and Abid is one of the most amazing professionals I've ever worked with, and I feel so honored to be able to interview you. And when, hopefully in a year's time, when you've done another 200-300 and you're everywhere, we can sit back and look at how many people you've helped. Hopefully. All right. Thank you, everybody, for your time. I hope you've enjoyed this interview. Make sure to download the ebook below this video, and we'll see you again really soon. Take care.